So guys, we're talking about iso-clam. So if you have low back pain or if you have constant QL tightness, I'm going to show you. Actually, let's go ahead and stand up so we can show what we're talking about. Typically, people have a gait issue when they have chronic low back pain, and typically we can find that there's a glute involved that's under firing or it's not working as well to keep the pelvis stable. So what she's going to do first is just take a normal squat. So go ahead and do a normal squat, and what you're looking for, can I face this way? So what you're looking for is, does the knee buckle? Face towards the camera so you can see. So what you would be looking for is, the knee cave in at all, especially for runners. If your knee caves in, what happens then, let's say this knee caves in a little bit, so she's going to cave that in. The foot collapses, knee's caved in. This glute's not firing well, so now what we have is the glute starts to unlevel like this, okay? And then stand up for me. Once that glute unlevels, now you have a situation where this knee's caved in. Go ahead and do it again. This knee's caved in. This glute starts to fall forward, so now you have anterior pelvic tilt here. What that does is when you walk, so go ahead and take a step with this foot. So take one step, hold. So what happens is, if this isn't firing, the pelvis is going to drop down. When it drops down, it drops this way because this isn't firing, because the glute's job is to activate here. What happens is your body now needs to shift its weight over this foot. But now that the knee's caving in, right, this is now coming up. Glute's not firing, it's not doing its job to keep this stable, so the whole pelvis tilts. Now what we're trying to do is, the body's like, well, I need to upright myself and keep my eyes on the horizon. So what it's going to do is going to correct, keep the eyes on the horizon. It's going to activate the QL muscle and tightening that up. Now you have this chronic tightness in your back that doesn't go away every time you take a step. So if you're getting adjusted and you get adjusted here, you feel good, and then you get up and it comes right back. This is probably why. So what we need to do is activate the glute, specifically the glute medius. So what she's going to do is, she's going to lay with the on your side here. So with the side, let's say it's the left side that's affected, the glute's not working well. You want to lay on your side. We're going to bring the knees to about a 45-degree position at the hip. So it's coming out here a little bit, and then 90 degrees at the knee. Now what I like to instruct is making sure that someone knows where their pelvis is to begin with. So you can put your hand right here on your pelvis. You can kind of start playing anterior, posterior tilt to figure out where's neutral so that we can fire into here and only here. What you'll commonly find is people will, when they're doing these iso-clams, they're over-firing on the front side here, the TFL. Remember, the TFL comes into the IT band, and that's why you have this, I have this chronic IT band tightness through here. That's because this muscle is probably over-firing. Now, what we want to do is slowly open the knee. So step one is slowly open the knee, keeping these feet locked together, keeping the pelvis stacked upright like this until you can only feel it right here. Okay, so go ahead and slowly open until you feel it here. Tell me when you feel it.
I feel it.
Point to where you feel it.
Here.
So have them point to you where they feel it. So right here is where she feels it. If she feels it through here, do you feel anything through here or down here? Anything like that?
No.
Okay, so we want to make sure that that's what they feel. Because if they're just going through the motion and they're not actually getting that brain-to-body connection, that brain-to-muscle connection, then you start to lose it. So you can feel the hamstring should stay loose, and then the QL right here should stay loose. So push there. That should be relaxed. Pelvis is neutral. This is relaxed. Hamstring's relaxed. And she only feels it here. Is that correct?
Mm-hmm.
Okay, so this should be tight. You should feel the tightness here, and loose here. The other thing you want to watch for, again, is when you start tilting forward like this, that's okay typically. But if you're coming back, then you start to recruit from the front. And then this will start to tighten. Where do you feel it now when you do that?
Here.
So now you feel it right here?
Yeah.
Instead of back here, correct?
Yeah.
So again, when people start compensating, they start to do that. So you need to roll forward a little bit here, get them into this position. I can't tell you how many times I see that where people want to kind of lean back and they get back into their old tight TFL, and then they start tightening up the hamstring, they start tightening up the back. So we need to push them forward a little bit. You can use a wall to kind of help, but the biggest thing is don't use a band yet until you can really connect just to that glute. Then, once she gets better at that, hold that for at least a minute. It should burn only in the glute. If you feel it anywhere, then you're compensating. You're recruiting other muscles, okay? So then what you do is open those legs up for me. Lift up. Got the big old marshmallow shoes on. All right, so you have the band here, like so. And so the next set, wait maybe 15 seconds until the burning kind of goes away. Then you're going to go right back into another set where, and sometimes you might notice that if I push this foot down into this foot, you can get a little bit more activation. If you're having trouble finding it, you got to play with this pelvic tilt. Back and forth. Okay, usually a bit more posterior pelvic tilt for probably most people. They'll feel a little bit more, especially since about, I don't know, 70% of females have more of an anterior pelvic tilt. Most people have this anterior pelvic tilt, but everyone's a little different. So you have to have them find which pelvic tilt's going to help them find their glute activation. Is that a little bit harder?
Yeah.
So that's going to be harder for her, but you can see the knee is about level or just outside the hip width. And that's kind of what you know. As you walk, you kind of figure, as I walk, I'm going to pretty much have my knee in line with the pelvis, with the hip. So you hold that for up to about a minute. Try to get 5 sets of these in. And again, that last 20 seconds or so should really, really burn in that glute area only. Again, not here, not here, not here. All those stay soft. We focus it right there. It's not about reps. It's about first get that isometric activation of the glute, because most of the strength that you initially get from this exercise, which also usually gets you out of pain the quickest, is going to be an isometric neurological connection. That's what's strengthening that pathway. It's a neurological connection that strengthens. It's not necessarily getting that muscle built right away. It's more about connecting it to the brain. If you guys have any questions, let us know.